watch this video, then we'll have a time for a Q&A, which I'll be available for questions, and Dr. Fisher should be joining us at some point as well to answer questions. So without further ado, let's get this party started. All right, can everyone see that fine? Okay, let me know if you can't. Let me know if you have trouble hearing it. Can everyone hear it?
No.
Okay.
If it's the video, no, we cannot hear.
Okay. Let's see what's going on. I think I have to do, yes, include computer sound. Okay. Oh no, what's going on? Apologies for the technical difficulty. Okay, let's try it one. Okay. Okay, take two.
Polio, because I know you've been getting questions out there. And the wonderful thing about the COVID Community Corps is you are now trusted resources of information. So I'm hoping that this will help you answer any questions that may come up during your conversations with people. So I'm going to start with my usual disclaimer. We know that this information is changing daily. And it's not just information about COVID-19 and SARS-CoV-2, but also now about monkeypox and polio. So the recommendations are going to change, and what you hear today may be outdated pretty soon. So trusted resources, New Jersey Department of Health, Centers for Disease Control. For pediatric stuff, American Academy of Pediatrics. For family physicians, this is also a very nice site. And then the New Jersey Immunization Network has a lot of all these have a lot of good information. This is just a one-page slide to remind us that there is now very good treatment for COVID-19. So for people who have no illness, we really want to prevent disease. So we give them vaccines. But we can also use this product called EvuShield, which is a monoclonal antibody, meaning it's an antibody made to just work against COVID-19. And it's a shot that you get, and it lasts for as long as 6 months. So this is for people who aren't expected to respond to the vaccines. This gives them the protection by giving them already made antibody. Now, as far as exposed people, you know, we talk about post-exposure prophylaxis for other things. We don't yet have anything for someone who's been exposed to COVID-19 but hasn't gotten sick. We don't know if things will come up in the future. For people with mild to moderate symptoms, but they aren't hospitalized, we do now have some treatments. And those include a medicine called remdesivir, or Veklury. And this is a medicine that has to be given by vein. And if you're not hospitalized, it's given once a day for 3 days. And it's a little bit hard to find that. There's also an oral medicine you can take called Paxlovid. And Paxlovid has the advantage of you being able to take it by mouth. However, it does have some interactions. So you have to be sure that you know what other medicines you're on and see if you have to change any of your other medicines. Then as alternatives, we have another oral medicine, Munipavir or Lagaviro, and then we also have monoclonal antibodies for treatment. And the only one that's currently still recommended is Bebtelovimab. Once you're in the hospital, then things get a little bit different. You still get the remdesivir. You may or may not get steroids, and you may or may not get other medicines to cut down on inflammation. And these guidelines have just been updated in the last couple weeks. So that's all I want to say about treatment. I do want to mention post-COVID conditions because I think you've been hearing more about this. This is called long COVID or long haul COVID or post-acute COVID. And these are the types of symptoms that people get. Trouble breathing, they're tired, they're fatigued. That gets much worse after just minor activity. They have pain everywhere, pain in their chest, their stomach, their joints, their head. Sometimes they have diarrhea. They can feel their heart beating with palpitations. They often have cough, problems sleeping, a pins and needle feeling in their hands and feet. They may have fever, be dizzy, have a rash, have changes in their mood, difficulty with smelling and taste, and changes in their menstrual cycle. They also may have this thing called brain fog. And brain fog is an inability to concentrate very well. So there's trouble with short-term memory. You might read a paragraph but not understand it. You might not be able to do mathematics as easily as you could before. So there's this very concerning problem with brain fog as well. Now, these are symptoms, by definition, to be called post-COVID. You have to have these symptoms a month after you got COVID. How common is this? Well, it depends. You can find an article that makes it anywhere from a couple percent all the way up to 80%. But most people would say the number is probably somewhere between 5 and 15%. But that's a lot of people when we realize how many people in this country have had COVID. So these are these long COVID symptoms. And we know if we can prevent COVID, we can prevent long COVID. So that makes these vaccines more important than ever. And as you all know, they're safe, they're effective, they're still free for everyone. You can get a vaccine if you're uninsured, undocumented, it doesn't matter. Just show up and you can get the vaccine. Now, here's the vaccines we have. We have the Pfizer and the Moderna. They were the first two to come out, and these are the so-called messenger RNA vaccines. And Pfizer's now for children as young as 6 months and anyone over 6 months. Moderna, the same. Then we have the adenovirus vector vaccine. That's the J&J vaccine, and that is just for adults. And then we have the recombinant spike protein vaccine, or the Novavax vaccine, which was just just authorized for use in June. And just yesterday, they changed the age, and it is now authorized for use in children 12 and adults as well. So 12 and older, including adults. Now, just to remind you how these work, messenger RNA is just a code. It's a little piece of information that tells your body's cells how to make a protein. And the protein in this case is the spike protein, those little things that stick out on the virus and allow the virus to make you sick. So you take that code, you put it into a little bit of fat, a lipid nanoparticle, that allows it to get into your cells, and in your cells, the code is read and spike protein is produced. And then because spike protein isn't human protein, your body makes a nice immune response to that. So you make both antibodies and then what we call cell-mediated protection. So these are the messenger RNA vaccines, the Pfizer and the Moderna vaccines. Then we have the adenovirus vector vaccines. And the only one we have in this country is the J&J vaccine. In the rest of the world, they also have another adenovirus vector vaccine, the AstraZeneca one. So in this case, that code for the protein is put into another virus, and that's a human adenovirus that's been changed so it can't reproduce itself, it can't replicate. So you put that in, the adenovirus allows that code to get into your cells. Again, when the code's in your cells start to make that protein, and then you get the immune response to the protein, very similar to the messenger RNA vaccines. And now we have a third type of vaccine, and that's this Novavax vaccine. And in this case, rather than putting the code into your body, you get the direct spike protein. And the way they make the spike protein is they take a virus and they put that gene in, that roadmap of how to make the protein. They put that in the baculovirus, and then the baculovirus infects moth cells, and the moth cells then produce that protein, the spike protein. So you can purify that protein, put it into a little bit of fat, add an adjuvant to make it work better, and then that can be injected into people and provides very good immunity against that spike protein. So that's the newest Novavax vaccine. Now I remind you, because this is a concern out there, is there any effect on fertility? And the answer is no. There's no evidence that any of these vaccines have any effect on fertility, either male fertility or female fertility. There's no biologic reason we would expect it to have it, and there's no clinical evidence. So both the American College of Oncology and Gynecology, of Obstetrics and Gynecology, as well as the Centers for Disease Control and Prevention, recommend this vaccine for anyone who's eligible, whether they're pregnant now, whether they're planning to be pregnant, or whether they've just been pregnant and are breastfeeding. So important information to remember, no problem with fertility. Just quickly, here are the vaccines we have for the ages. So for children 6 months to 4 years, we have Pfizer, which is given as 3 doses, or Moderna, which is given as 2 doses. For children 5 to 17, either Pfizer or Moderna, and again, 2 doses. And now we also, I didn't add this to the slide, but I should have, for children 12 to 17, they also could get the Novavax vaccine. For adults, there are now 4 choices. The Pfizer, 2 doses, 3 to 8 weeks apart. Moderna, 2 doses. J&J, single dose. And Novavax, 2 doses, 3 to 8 weeks apart. For compromised, for people who have an immune system that doesn't work as well, then we want to give them an extra dose. So if they got Pfizer or Moderna to start with, we give them a 3rd dose and then a booster dose 3 months after that. So a total of 4 doses. If they got J&J as a first dose, they can get a 2nd dose of J&J, a booster dose 2 months later, and those second and booster doses really could be Pfizer or Moderna as the preferred additional doses. For Novavax, you get that 2nd dose 3 weeks later, but Novavax is not yet approved for use as a booster. So right now, if you're immunocompromised, you're probably better off to get the Pfizer or Moderna because the boosters are available. But I think in the very near future, probably Novavax boosters will be authorized, but they are not at this time. There are also booster doses. We know that everybody now needs booster doses because your protection drops over time. So there are booster doses recommended for everyone 5 years of age and older. They can get Pfizer or Moderna 5 months after the first dose. For Moderna, it's a half dose. For Pfizer, the same dose. Moderna is not yet authorized as a booster for children, and Novavax is not yet authorized for boosters. And remember that Pfizer and Moderna are now preferred, but you are allowed to do mixing and matching. Certain people need a 2nd booster, and these are the people who are at highest risk to get into trouble with COVID-19. So older people, over 50, people 12 and older.
I will step in at this point and say that there has been an update in terms of 2nd boosters. So I'm going to fast forward a little bit.
Thank you, Gabe.
There we go.
Another thing about boosters, I know this is you're now hearing about this fall bivalent booster that's coming out. Bivalent means that it has 2 strains in it instead of the usual vaccine that we've been dealing with that is a so-called monovalent, just one strain. So these fall ones will have the original strain, but then it will also have an Omicron adapted strain. So, and the Omicron adapted strain depends on whether you're getting Pfizer or Moderna, but both of these will definitely give you better protection against the Omicron variants. So these are going to be available. Pfizer's will be available for 12 years and up, Moderna for adults for sure, but possibly also for greater than 12. And we don't yet know for whom these will be recommended. So they haven't been authorized yet for use, but they are expected to be available by September, either early in September or a little bit later in September. So we will want particularly high-risk people to get this new fall bivalent booster to really ensure that they have the best possible protection.
Okay. And as Dr. Fisher said there, actually it did become available in early September. So now the bivalent booster is basically serving as the booster for anyone, and anyone who's received their last dose can receive their bivalent booster 2 months out from their last shot, whether that was your primary series or your first booster, in order to ensure that you have protection against the newer Omicron variant that's now predominating the COVID-19 scene. And so that's the newest update, is that that is the booster that we're now using moving forward. And so if folks are asking you about booster shots, that's the one that will be given.
So bottom line, protect yourself and your families, get a booster dose. But of course, for anyone who hasn't yet got the primary dose, go ahead and get that primary dose, get your vaccine journey started. This is how we're doing in New Jersey. You can see we're doing very well in the older age groups as far as the primary series. We've gotten just about everybody immunized with that primary series that's 65 and above. Not quite so well in the younger age groups. We still have a long way to go with these young children and now with the infants and preschoolers. But remember that infants and preschoolers just have had the vaccine recommended in the recent past. As far as the first booster doses, again, we're doing much better with the older population. 75%, 77% of older people have had that first booster. And then for those second boosters, we're only at about 31%. We'd like to be a lot higher than that. So we still have lots and lots of people, about 3/4 of people who live in New Jersey are eligible to get another vaccine. Let's shift gears now and talk about monkeypox. So monkeypox is a virus. This is an electron microscope picture of the virus. It's in the orthopox family, and the other orthopox viruses that you've heard of are smallpox, but also cowpox, and now monkeypox or human monkeypox virus. The disease is similar to smallpox, but it's milder. And prior to this outbreak, almost all cases were in Africa. The monkeypox virus is spread by direct contact with the skin sores or by close face-to-face contact. It can also be spread by contact with linens or towels that have been used by someone who has the skin sores. So if we say what's happened with monkeypox in the US, back in 2003, there was an outbreak of monkeypox in the Midwest, and it was among people who had prairie dogs as pets. And what had happened was the prairie dogs that were being sold as pets were kept in an area where there were some rats that were also being sold as pets, and the rats were from Ghana, and they were infected with the human monkeypox virus. And what happened was the prairie dogs then got infected, and their owners, primarily children who handled them, also were affected. And there were only about 13 cases in this outbreak. The current outbreak is much different. So this year, the outbreak has been primarily, but not entirely, in men who are having sex with men. But anyone can be infected, and we know that household contacts of people with monkeypox are becoming infected. So this is what's happening in the United States and in New Jersey. In the US, there are now about 14,000 cases, and you can see the numbers continue to climb. These numbers that are lower are weekends, and weekend reporting is just less. If we look at New Jersey, we've had 420 cases so far, and again, there's a delay in the reporting. We go to the next slide, we'll see what's happening globally. And you can see the United States actually has the top number of cases by count. Some of that may be our ability to identify this a little bit better, but you can see we're leading the pack. These blue dots are where historical cases of monkeypox were, and they were mainly in sub-Saharan Africa. But now you can see that with this new virus, it's really spread throughout the globe. Here's in the United States, the darker the state, the more monkeypox they have reported. And you can see New York and California are leading, with Florida and Texas and Georgia pretty close behind. Here in New Jersey, we're about 8th in the country, and we have, again, 420 cases. Globally, over 42,000 cases, and the numbers continue to climb. Now, what are the signs and symptoms that you have monkeypox? Well, the classic disease starts with fever, headache, pains, chills. Then you get the rash a little bit later, and your lymph nodes, your lymph glands swell up. With this outbreak, not everyone has gotten the fever, headaches, pains, and chills. Some people just have the rash and the enlarged lymph nodes. That rash can be localized in just one area of the body, or it can go all over your body, and the rash lasts for about 2 weeks. Now, the rash starts out as a little red spot, then it becomes raised, then it gets full of fluid, then the fluid turns to pus, and then it scabs over. And that takes about 2 weeks to go through this whole phase, and a person is contagious for those entire 2 weeks until every one of the scabs has fallen off. So here's a picture of what those look like. So you can see none of these just have the flat red spot, but these have progressed a little bit more, and you can see this has sort of clear fluid in it. This has more pus in it, and these go on and last again for about 2 weeks. They can be very extensive, or they can be just a few of these lesions. And they can include the face, the hands, the extremities, or the genital area. How do you make the diagnosis? Well, it's made by a physician who knows what they're looking for, and it can be a clinical diagnosis, but then you want to confirm that by testing those skin sores, because it can be confused with some other sexually transmitted infections. The PCR test is what's used to confirm that's an orthopox, and then that is sent to the CDC to see which orthopox it is. Is it the human monkeypox virus or another orthopox virus? There is treatment available, but this is an investigational drug, and it requires a physician to give a special request to get the drug. We do have the drug in New Jersey, and we have been treating people in New Jersey. We've already treated over 50 people within New Jersey. Prevention, I always like prevention rather than trying to treat something. And the main prevention here is to avoid contact. And if you've been exposed, to get a vaccine to prevent you from getting sick. If you get the vaccine soon after exposure, you may totally prevent the infection. If you get it a little bit later after exposure, you will make the infection be not as severe. Unfortunately, these vaccines are in limited supply. Right now, we're just using the NJDOH vaccine, and for some people, pre-exposure vaccine is recommended. People who work in laboratories could get pre-exposure, and also people who have a high risk of being exposed will be eligible for that pre-exposure. But remember, we have limited amounts of vaccine. So these are two documents that are present on our New Jersey webpage, and I would highly recommend them to you. The monkeypox key facts has been translated into Spanish. These would be great for you to have to give out to people who want more information. And then there's also a one-pager on where to find, on who can get vaccinated and where to find the monkeypox vaccine. I'm going to now, this is a summary of the key information about monkeypox. It's a relatively rare disease caused by infection with the monkeypox virus. And it's part of the same family as smallpox, but it's not the same as smallpox. So those early symptoms may include fever, headache, muscle aches, backache, swollen lymph nodes, and chills and exhaustion. And then the rash can appear. But remember, in this outbreak, not everyone gets those early symptoms. And the whole illness lasts between 2 and 4 weeks. It's spread by direct contact with that rash or by contact with objects used by someone who has the rash. It can also be spread by respiratory droplets. So being face-to-face, close face-to-face with someone, it can spread in that way. And it can spread until all of the sores have healed. As far as treatment and vaccination, the vaccine is the JYNNEOS vaccine. Some people, but not everyone, is eligible to get it. And it is given by local health department packs. And then there's also many sites now, 10 sites across the state where it's offered to people at high risk. Although there's no approved specific treatment, there is this medicine, TPOXX or tecovirimat, that's an investigational drug that we are using here in New Jersey for people who are infected and have severe symptoms. Let's finish up with polio. I have to tell you about polio because after almost a decade of no polio at all in the United States, there was a diagnosis of paralytic polio, so a person who's paralyzed in Rockland County, New York. So close by, and this person was diagnosed in July of 2022. And we know that this person was unvaccinated and that the person traveled to Europe to attend a wedding. We also now know that polio has been detected in wastewater in New York City, and not just in wastewater from Rockland County, but in several areas of actual New York City. And that strain that's been detected in New York City is similar to the strains that have been found in the United Kingdom and in Israel. So we have to think about polio because, you know, we're trying to eliminate polio from the world, and even a single case of paralytic polio is considered a public health emergency. So there are 3 types of polioviruses, type 1, type 2, and type 3. And the good news is only type 1, wild type 1, remains in the whole entire world. Type 2, wild type 2, and wild type 3 have been totally eliminated. Type 2 was declared eradicated in 2015 and type 3 in 2019, with the last case in Nigeria for type 3 and the last case in India for type 2. In the United States, the last case of wild poliomyelitis occurred in 1979. Now, one of the things that we've used to make polio go away are these oral polio vaccines. And that's great. Oral polio vaccines are wonderful, and they've helped us eliminate polio from much of the world. But unfortunately, the vaccines in the oral polio vaccine can go back. They can revert to being a virulent vaccine, a vaccine that can cause poliomyelitis. So these are called the vaccine strains that go back, that revert, cause vaccine-associated paralytic poliomyelitis. Because we knew about these strains, in the United States, we stopped giving oral polio vaccine way back in the year 2000. We switched to all inactivated polio vaccine. And across the globe, they are now doing the same thing, moving to IPV, and they've also stopped giving oral polio vaccine type 2. And now they just give type 1 and type 3 because type 2 was the one most likely to revert. So one of the things we need to know about polio infection is that most of the people, the majority of people, 70% of people who are infected with this virus have no symptoms at all. They don't know they're infected. They don't know they're shedding the virus. They don't know they're contagious. About 25% will have a little kind of sore throat, fever, a little nonspecific illness. Only about 1 to 5% will have viral meningitis, which is an inflammation of the covering of the brain, and less than 1% will develop the paralysis. And the paralysis is usually asymmetric, so one leg or one arm, rather than both. If the paralysis involves the nerve to the diaphragm, then a person will unfortunately not be able to breathe on their own. And we have this thing called bulbar polio, where the cranial nerves are involved. And as I mentioned when we started, a single case of paralytic polio is considered a public health emergency. Actually, if you even knew that someone was shedding the virus, that's considered a public health emergency. And since we had it right in New York, and we know it's in the wastewater, we're trying to get people aware of this in New Jersey. So this is a totally vaccine preventable disease. For infants and children, they should get 4 doses of the inactivated polio vaccine at 2 months, 4 months, 6 to 18 months, and 4 to 6 years. And they're protected. 95% of people are protected after just 2 doses, but we give the extra doses to be sure we get that last 5%. And we think that the immunity to polio is probably lifelong, but because of this outbreak and because many adults don't know if they were vaccinated when they were younger, it is suggested that adults who are at increased risk of exposure, so suppose you lived in Rockland County or you were a contact of the person with polio, you should complete your series if you hadn't gotten all 4 doses as a child. And if you got all four doses, you could consider getting a one-time single dose as a booster. So that brings me to the end of what I wanted to tell you. I know I've talked a little longer than usual, and you probably have lots and lots of questions, and I will try to be able to join you at some point to answer questions, but unfortunately, this is.
All right. Thank you, Dr. Fisher. And now our very own in real life, Dr. Fisher, as she said, has a lot of questions and is now here to answer those questions.
I hope I started my presentation with my usual disclaimer slide, and that was everything's changing. So what you heard in that video was already out of date by the time you got to hear it. So we tried to think about it and record it in advance, and sometimes that doesn't work as well as we'd like it to. So now I'm happy to take questions.
All right, go ahead, Nicole.
Yeah, good morning. Thank you very much, Dr. Fisher. I just want to have confirmation with regards to the COVID vaccinations. I have ran an event yesterday and was fielding a lot of questions with regards to the new bivalent vaccine and who is recommended to receive that vaccine. I have a young population who have certainly received their vaccines, full series, and have received their boosters, and they want to know, can they receive the new bivalent booster?
Oh, that's wonderful. That's the kind of question we'd love to have, not, oh, I don't need it. So the vaccine, the bivalent vaccines are recommended for everyone who is old enough. Okay, so it's for 12 years of age and older. And the requirement is that you have to have received a primary series, and it has to be at least 2 months after your most recent shot. So whether that recent shot was the second of your primary or whether it was another booster dose, it needs to be 2 months after that. And it is recommended for young people as well as older people. And I'm actually really happy to let you know that we've given over 100,000 doses already in New Jersey. You know, it's only been available for 2 weeks, a little more than 2 weeks. And what we've seen is that people between the ages of 30 to 39 and 40 to 49, about a quarter of our doses are in each of those groups. And we're actually quite happy with that because we know this is definitely an at-risk population. And then we're also doing better in the older people. So, but it's for everyone. As far as the children go, you know, this is going to be one where you heard this on September 20th, and it may change by tomorrow. We're waiting to hear an approval for a booster, a bivalent booster for the younger ages. But that, you know, has not happened as of now, but it's expected for that 5 to 11-year-olds. Remember that there are not that many of them who are already 2 months after their series, but if they are, yes, they will eventually get a booster. Right now, they have to get the monovalent booster, the old booster. But we hope that pretty soon they will be eligible to get the bivalent booster, the
Wonderful.
updated booster.
Thank you very much. That's great. Thank you.
Oh, you bet. Are other people finding that there are people lining up to get this booster? Because that's really great news. That's what we want to happen. Or are you getting a lot of hesitancy and, oh, I don't know if I need it, you know, maybe as President Biden said, the pandemic's over and we don't have to worry. Well, you know, my comment to that is, oh, come on, guys, 10 people dying a day. I think we need to keep worrying.
Our folks were very, very eager yesterday, so it was exciting.
Oh, that is great. Thanks so much for that feedback.
I'm getting a mix of both. Some
Okay.
excitement, some questioning it. So
Good. And I hope this made you feel a little bit better equipped to be able to answer their questions.
absolutely, thank you.
That was what we wanted to do. And we figure you're also, even though you're not the monkeypox polio people, when people trust you, they tend to ask you all of their healthcare questions. So we wanted you to be aware of what's happening for those two. And for just so you know that the monkeypox outbreak occurs to be kind of leveling off, but we are up to 661 cases here in New Jersey, and we're still seeing about 5 to 10 new cases a day. So it's slowly going down, but we're not done with it. And the other update is we expanded the eligibility for the vaccine. So in the past, you were only allowed to get the vaccine if you had a known exposure, or if you had a situation where it was very likely you were exposed. Now you can get it ahead of time. If you're anticipating that you may be exposed, as long as you live in an area where there's monkeypox, which is all of New Jersey, pretty much, you can get the vaccine. So we're really gearing it for the high risk people, which right now is men having sex with men, or female partners of men having sex with men. So that would include sex workers as well as others who might have multiple partners and not be sure. So they can protect themselves by getting immunized ahead of time.
All right, any other comments from the group? Questions, y'all? Hey, I'll let you stew on it for a second. So we do want to show you where you can get more information up to date at the NJDOH website, of course. So I'll share my screen once again. So for monkeypox, our lovely CDS team, Communicable Disease Service team, has put together this lovely website about human monkeypox. And here you can find out both the cases that are happening throughout New Jersey. There's also this dashboard where you can actually get a view as to where the cases are spiking, which is important, especially for those of y'all up in North Jersey. That is where we're seeing the majority of cases. But as you can see, there's a pretty healthy distribution across the map as well. So this is good information to share with folks, especially folks who may be doing outreach or canvassing up in the north, just to let folks know. And this is also where you can go in order to get vaccine information. So we're truly blessed to now have a lot more vaccination sites easily available to folks. So this is a place where people can look up where they can go get a vaccine nearest to them. Similarly to monkeypox, we also have our page, CDS page on COVID-19. As Dr. Fisher says, while it seems like our monkeypox information is staying relatively linear, it seems that COVID-19 ever since the start has always been, new updates every other week, it seems. So be sure to come to the page in order to stay up to date on the newest information, as well as the latest CDC recommendations when it comes to traveling, what to do when you test positive, things of that nature. As well as a dashboard, which allows for you to see how the cases are doing in the great state of New Jersey. So again, we can see where we're seeing the cases predominantly by county, and also to get a longitudinal vision as to how we're doing in terms of cases. So as you see right now, we are saying relatively low for, I guess, what we've, become used to at this point. But as we all know, especially with the holidays, people starting to go inside, people starting to congregate indoors, travel for the holidays, we know that we always start to see cases creep back up around those times. And when it comes to monkeypox or any other communicable diseases, that means that there's a chance of also transmission of those as well, which is really why we wanted to have this session, is just to let folks know as we're going into the fall, we are entering a different landscape, which means that we may all need to be a little bit mindful about our own health in order to prevent the spread of these things to other folks as well. All right. Any other questions from the group? Or any? I'll start with any questions, and I have a second question. Okay, the second question. From the presentation you saw today and the materials that you've seen and what you've been hearing on the ground, what are some of the more effective ways, or what are some ways in which you think that we can become more effective in our messaging? Or what's something that you're hearing in your community that would be really helpful for us to, when making new materials, to do outreach and get information to the community?
I would say at most events, a lot of people just have questions about the side effects, and that's like the biggest worry about getting the vaccine, is that they don't, they're like, oh, I have to work tomorrow, or tomorrow's Saturday, I don't want to be sick, So the biggest thing that I'm hearing is side effects, concerns about that.
Thank you, Taylor.
With monkeypox, the question I've been getting is there breakthrough cases? Like, or are you protected once you get the second dose?
That one's the first one. The side effects question is easier to answer. The side effects from the booster doses is pretty much the same as the side effects from the original doses. Most of those are mild side effects, pain at the injection site, the things you get when your immune system's working. So maybe a little bit of fever, aches and pains. And some people get more severe symptoms than others. So I have been told that there definitely are people who feel like they can't work the next day. But most of them are much milder than that. And in children, they also tend to be milder. Children, I think, are a little more resilient than we are as adults. I got my booster yesterday, so I just have a little pain in my arm, fortunately, and nothing really else. But headache, body aches, that kind of thing. And sometimes you can kind of reassure people that really tells them your immune system is working. But for people who don't get those, it doesn't mean your immune system isn't working. It's just that some people have more side effects than others. For the breakthrough cases on monkeypox, this is the first we're using this vaccine against monkeypox. So that we're trying to collect that data, but we honestly don't know. What we know is that if you give the vaccine within the first 4 days following exposure, you may totally prevent the disease. If you give it like day 7, 8, 9, you likely won't prevent the disease, but you may make it a lot milder. So one of the issues is people don't always know exactly when they were exposed. So, are they really a breakthrough case, or were they exposed and didn't realize it, even before they got their vaccine or got their second dose. And you do need both doses, so it's 1 month apart. So 2 weeks after your second dose is when you're considered to be protected.
Thank you.
You bet.
Nicole?
Yeah, I was going to echo what Taylor had said earlier about timing of the doses being a major concern for a lot of people, some of them aiming to take the vaccines for COVID on a Friday so that they can rest over the weekend. But yesterday we heard a lot about flu and timing of the flu shots, and people are thankfully paying attention, and they're concerned about how aggressive flu is supposed to be this season, especially with what just happened in Australia and that season, and looking ahead. So the timing of the two of them has been an issue, and trying to encourage people that it's okay, you can take them both the same day, and people making a choice was also something that I heard, and some of them saying that they would prefer to take the flu shot over the COVID shot because they already have some COVID shot on board, but they have no flu shot on board, right? So it became a balancing act.
Yeah, that's a tough one. And, you know, flu season usually doesn't start until December. So you usually have plenty of time to get your flu shot. We are predicting a possibly earlier start to the season this year, but I would say COVID is here right now circulating like crazy. So, you know, if I had a choice, I'd get them both on the same day if you can. But if for whatever reason you don't want to do that, I would push the COVID, but tell them, yeah, you need to get your flu shot shortly. And if they got COVID yesterday, they can get flu shot today. There's no waiting time between doses.
All right, thank you.
Yeah.
And even on top of that, you can get your monkeypox vaccine as well, all in the same short time frame. So I know when we work with a lot of, disenfranchised communities, a lot of the stuff that we do, right, folks can't take a lot of time off of work. And so when I think effective strategy that, when we talk to folks, is just say, hey, maybe that you'll have to take 1 day off, but you can also get 3 vaccines that will protect you, your family, your community all at the same time. So, I think it's about just letting folks know that, would you rather take 1 day off, or would you rather have possibly weeks off if you get sick with any of these diseases, right? So
that's a great selling point. Thanks.
And I'm not sure if you mentioned this, but if people are interested in getting the monkeypox vaccine, where can they go to get that?
Yes. So you can check out the website. I think most major cities at this point have at least one vaccination site.
Okay.
So I think we're at possibly over 15. Don't quote me. So there it is available. But yeah, I would say definitely check out NJDOH. I'll throw the link in the chat. And then there's a place you can go to see where the nearest site is to you.
Perfect. Thank you.
All right. Well, if there is nothing else, thank you everybody for coming out for this training session. I think it's important to stay up to date with our information, especially as we're doing health in the community. And as we're hearing, every month it's a new story in the infectious disease landscape. So it's nice to be able to stay up to date. And we're really grateful to Dr. Fisher for being able to come and give her medical expertise on all of this. So thank you, Dr. Fisher, for being here.
My pleasure always. Thanks. And thanks for everything you all are doing. It's very clear to me that you have become trusted sources of information, and that's what we need out there. Trusted sources of scientific, appropriate, up-to-date information. So thank you all for that. All right. Take care. Have a good day.
Thank you,
Once
everyone.
again, thank you
Bye,
everybody
good
for
day.
your time. I will have the recording sent out to you all later this afternoon. Okay.
Great. Thank you.
Thank you. Bye-bye.
Bye, everyone.
Okay. All right, so now it's time for outreach. The bags that have the 5 condoms in them, I think those are the ones that should go, because we did some with only 3 in them.
Yeah.
And I figure maybe about 25 to 30.
Mhm.
And so we'll be able to get